to 250 million due to coronavirus. What discussions is the Secretary of State having across the international community to work to alleviate this humanitarian catastrophe?
Secretary of State.
Thank you, Mr. Speaker. Coronavirus is a global crisis that knows no borders and will have a profound effect on all countries, including the most vulnerable. That is why the UK is leading the international response and providing £744 million of UK aid so far to counter the health, humanitarian and economic impacts. I have mobilised my department and our country offices to do whatever it takes to help tackle this pandemic and those secondary risks. We have the funding, the expertise and the British determination to stand by our friends in developing countries to prevent a second wave of infection.
We now go over to Preet Kaur-Gill. Preet Kaur-Gill.
Thank you, Mr. Speaker. During the coronavirus pandemic, it is imperative that countries and communities engage cooperatively with one another to avoid a scramble to procure goods, PPE and medical equipment to ensure there isn't a worldwide shortage which prices out the world's most vulnerable. And in light of the President of the United States' announcement on ending funding to the World Health Organization, can the Secretary of State outline what representations she and her government have made to him regarding the need to follow collaborative principles which will benefit us all?
Secretary of State.
Thank you, Mr. Speaker. The UK has confidence in the WHO and the work they are doing globally to bring together every country to do the best they can to look after their communities and citizens. And they are coordinating PPE for all those countries, and we are supporting them by making funding into that central pot so that they can make sure that those countries most in need will also have the PPE that they require.
We've got a substantive question. Sarah Champion, Secretary of State.
Apologies, Mr. Speaker. Thank you, Mr. Speaker. There is no country better equipped. Oh, I beg your pardon, if I may group questions 2, 6 and 18, Mr. Speaker. There is no country better equipped to help the world out of this crisis than the UK. Over the last 10 years, this government has made DFID into a global leader in international development and reaffirmed its commitment as one of the world's biggest development donors. It is no surprise then that the UK is at the forefront of the global response and has committed up to £744 million of UK aid so far, including the highest level of funding for CEPI to find a vaccine. We are working with other donors and refocusing our programmes on the urgent response to coronavirus.
Sarah Champion, we go over to Sarah Champion.
Thank you, Mr. Speaker. I'm really well.
Fortunately, we have no sound. We will now have to go over to Richard Bacon. Richard Bacon.
Mr. Speaker, I welcome the Secretary of State's Garvey announcement. Does she agree that the long-term outlook for DFID's joint funding of vaccine research projects, with, for example, the Bill and Melinda Gates Foundation and others, will be more secure with a separate international aid department than if DFID were merged into the Foreign Office?
Secretary of State.
Oh, excuse me. Thank you, Mr. Speaker. Our response to COVID-19, including on vaccines, treatments and testing, is a great example of joint working between DFID and the FCO, as well as DHSC and BEIS experts. We are able to combine our world-class diplomatic network with DFID's global leadership on development. We are proud of the UK's close partnership with the Bill and Melinda Gates Foundation, and including on the Wellcome Therapeutics Accelerator Initiative, to which we have committed up to £40 million, aiming to bring 100 million courses of COVID-19 treatment to those who will need it most in 2020.
We now go over to Wendy Chamberlain.
Thank you, Mr. Speaker. I welcome DFID's announcement in relation to supporting efforts of the spread of COVID-19, but we need to address support for NGOs. NGOs have been granted just 20 million, and they say they need 100 million in order to move quickly and effectively to help mitigate the effects of this humanitarian crisis. Today, I have sent a cross-party letter signed by over 100 parliamentarians from both houses calling on further funding to be made available. The world does look to the UK in terms of international unilateral response. So will the Secretary of State reconsider NGO funding?
Secretary of State.
Thank you, Mr. Speaker. We have made so far commitments into 3 areas of funding: resilience for vulnerable countries through international appeals from WHO, UNICEF and UNHCR, the International Red Cross and Red Crescent, to whom we've pledged £55 million, Unilever, where we are doing a £100 million project, of which DFID is £50 million, to help reach over 1 billion people with sanitation training and tools, alongside our over £300 million towards vaccines and therapeutics. DFID continues to lead in setting forward how all countries must help tackle this great invisible killer.
We now go over to Chris Law. Chris Law.
Thank you, Mr. Speaker. With virtually no testing capabilities, limited supplies of ventilators and a scarcity of hospital beds, the impact of the coronavirus on the 70 million refugees who are currently living in overcrowded camps will be catastrophic. Since my letter highlighting this to Secretary of State at the start of the month, what steps is she taken to increase spaces for screening, isolation and quarantine for the world's most vulnerable people?
Secretary of State.
Thank you, Mr. Speaker. In these early stages, DFID has led the world, as I've said, in its commitment to supporting those organisations that can reach into those most vulnerable communities, into the refugee camps and so on, and 75 million to WHO, who have access there, 25 million to UNICEF and 20 million to UNHCR as initial commitments. We hope will help those most able to reach the most vulnerable as quickly as possible.
We're going back across to Sarah Champion. Sarah Champion.
Thank you, Mr. Speaker. Bond's recent COVID-19 survey reveals that 86% of UK NGO members are cutting back or considering cutting back in-country work. So how is DFID making sure that 30 years of work in alleviating poverty doesn't unravel as health systems come under more strain in lower income countries?
Bruce State.
Thank you, Mr. Speaker. The Honourable Lady is absolutely right that there is a real challenge here for those of us who are committed to helping those vulnerable countries to become stronger and more self-sufficient. We have had to bring some of our team home, but many are still in country, and indeed for all those who are, we are finding as many ways as we can to support in country, both from the economic side and the healthcare side, to make sure that those countries don't fall over, and that the work that has been painstakingly built up to help them develop strength and self-security will not fall backwards.
We have a substantive question. Lawrence Robertson.
Thank you, Mr. Speaker. The devastating locust outbreak in East Africa has paralysed communities that are already facing the daily threat of starvation. With British expertise and funding, we are supporting the international effort to track, stop and kill dangerous swarms of locust. With rising temperatures driving these infestations, Britain is stepping up to help vulnerable communities prepare for and adapt to the catastrophic impacts of climate change.
Lawrence Robertson. Over to Lawrence Robertson.
Thank you, Mr. Speaker. As the Secretary of State has said, already millions of people live in food insecurity in East Africa. There's been poor seasonal rains recently, and then the locust infestation. So can the Secretary of State therefore use the DFID budget in order to provide food aid of a nutritional quality to people who, through no fault of their own, face the most basic problem very urgently?
Secretary of State.
Thank you, Mr. Speaker. DFID programmes are supporting enhanced regional trade and access to nutritional food in East Africa. In Ethiopia, the UK is supporting the Productive Safety Net programme to provide food and cash to 8 million of the poorest, and the UK's recent £12 million contribution to UNICEF will provide malnourished children with nutritious food. We continue to work with governments in the region to ensure that essential supplies reach those in need.
We have a substantive question, Marco Longa. Secretary of State.
Thank you, Mr. Speaker. The Government is steadfast in our commitment to ensuring girls throughout the world receive 12 years of quality education. As well as supporting multilateral education programmes, the UK Girls' Education Challenge, with projects that span 17 of the world's poorest countries and reaching over 1 million marginalised girls, is responding to the current pandemic. British expertise is working so that schools are able to reopen when it is safe to do so without further delay.
Go across to Marco Longe. Marco Longe.
Thank you, Mr. Speaker. Does my right honourable friend agree with me that whether you are in Dudley or Malawi, one of the key success factors impacting on children's education is for parents to understand the value of education? And if so, what is the government's approach in relation to this specific point?
Secretary of State.
Thank you, Mr. Speaker. As we all know, parents are a key success factor in children's learning around the world. UK aid programmes draw on evidence which shows that school attendance and learning can improve when parents and children know about the benefits of education to incomes and have local information about the choice of school quality. DFID programmes also address the cost and time barriers to education, especially for girls, to promote the vital role of teachers in children's learning.
We now go across to Yasmin Qureshi. Yasmin Qureshi.
Hello? Thank you, Mr. Speaker. We know that the Ebola showed the wider impact of infectious diseases on women as schools closed and teenage pregnancies spiked. But the impact of COVID-19 will be even greater in ever-populated refugee camps. In Bangladesh, nearly 1 million Rohingyas now live in very cramped conditions in the Cox's Bazar, 70,000 people per square metre. In this tiny area, women's education suffers, but we'll also see a rise in gender-based violence, similar to the current pattern in the United Kingdom. What specific action is the Secretary of State taking to deal with this issue?
Secretary of State.
Thank you, Mr. Speaker. The COVID crisis has removed 1.5 billion children from school, putting the most disadvantaged girls at risk of dropping out of school permanently. School closures will significantly reduce learning hours, particularly for the most disadvantaged children, and we risk many dropping out permanently. Prior to the crisis, 258 million children and young people were already out of school globally, and over half of them girls. The Ebola crisis showed us that female pupils bear the brunt of school closures during disease outbreaks, leading to higher levels of sexual exploitation, abuse, teenage pregnancy and early marriage. So we will continue to prioritise, as part of the international response, education for all.
We now call Minister Morton, who will answer the substantive question tabled by Elliot Colburn. Minister Horden.
Thank you, Mr. Speaker. Science can help us deal with this crisis. To date, the UK has committed over £313 million into innovative research and development of vaccines, rapid diagnostics and promising therapeutics for coronavirus. The UK is the world's top donor to CEPI, which is helping produce a vaccine, including at Oxford and Imperial. We're also funding innovative research on virus tests and antibody tests right here in the UK, which could be suitable for use in developing countries. On Friday, the UK proudly stood with the WHO, the UN and 20 countries to work for global access to vaccines to end the pandemic, save lives and start the global economic recovery.
Okay. And this is a group question, but I go over to Elliot Colburn. Elliot Colburn.
Thank you very much, Mr. Speaker. And Carshalton and Wallington residents know that the development of a coronavirus vaccine is the greatest opportunity to save lives across the world. So I'd be grateful if the Minister could confirm that the UK is one of the largest global donors to the International Coalition Epidemic Preparedness Innovations, who are at the forefront of this global research.
Minister.
Thank you, Mr. Speaker. I can confirm that the UK Government has committed £250 million to the International Coalition for Epidemic Preparedness Innovations, or CEPI, to rapidly develop coronavirus vaccines. This is the largest contribution of any country to CEPI's COVID-19 efforts to date and is a major contribution to global efforts to accelerate vaccine discovery and in ensuring a vaccine is available to all, including the world's poorest countries. We're asking all governments to contribute to this important international goal as a down payment against the wider funding needs of the COVID-19 response.
We now go over to Steve McCabe. Steve McCabe.
Mr. Speaker, we've all witnessed the battle for access to the drug, or can be, for children in this country, what consideration has the government given to requests for a patent-free vaccine, thus ensuring that the millions of pounds ploughed in by British taxpayers recognises the truly global nature of the crisis and does secure a vaccine for all, rather than a fight over excessive pricing and huge profits for 4 or 5 pharmaceutical corporations?
Minister.
Thank you, Mr. Speaker. This is a very important point because, of course, a globally accessible vaccine alongside effective tests and treatments is needed to end this global pandemic and to start global economic recovery. This will need an unprecedented global collaboration and resourcing to drive the speed and scale that's needed. And the UK is at the forefront of global efforts to meet this challenge. Now is the time for us to come together to develop and deliver vaccines, tests and treatments that are safe, effective, affordable and accessible to all.
We now go over to Henry Smith. Henry Smith.
Thank you, Mr. Speaker. The UK is the World Health Organization's second largest funder, yet that agency has been found wanting and subject to political interference by the Chinese Communist Party. After this pandemic, will the government look at a new World Health Order, as suggested by the recent Foreign Affairs Committee report?
Minister.
Thank you, Mr. Speaker. The honourable member is right to recognise that international cooperation is absolutely vital to tackle COVID-19, and that's why we are working with the WHO and other international organisations to develop and deliver a globally accessible vaccine alongside effective tests and treatments. And it's because of this that we want to ensure that they are safe, effective, affordable and accessible for all, including the world's poorest.
We now go across to Preet Kaur Gill. Preet Kaur Gill.
Mr. Speaker, this week is World Immunization Week, and every year millions of lives are saved thanks to immunizations, and it is recognised widely as one of the most successful and cost-effective health interventions. And with DFID funding going into the global effort to tackle this health crisis, can the Secretary of State explain what safeguards she has implemented to ensure UK public contributions to the research, development of COVID-19 diagnostics, treatment and vaccines will be guaranteed to every person, and assure the British public that public money isn't just going into lining the pockets of big pharmaceutical companies?
Minister.
Thank you, Mr. Speaker. Of course, whilst we are focusing on COVID-19, there is the broader issue of vaccines. And the UK is already one of the biggest global donors. And to date, we have pledged £744 million to support the international response in terms of COVID-19. We have also funded £40 million into the Wellcome Mastercard Therapeutics Accelerator Initiative, up to £23 million to the funding for foundation for innovative new diagnostics, and up to £5 million through the joint initiative on research for epidemic preparedness. Because we're faced with a global pandemic, we absolutely need an international response, and it is about making sure that vaccines reach all those who need them.
We have a substantive question. Robert Coach, Minister.
Sorry, Mr. Speaker. We will always stand by the overseas territories, Mr. Speaker. A range of government departments led by DFID and the FCO are supporting the overseas territories to mitigate the impacts of the pandemic. Support includes essential medical supply, public health advice, security and access support, and financial aid to mitigate the economic impacts in the most vulnerable territories.
We go across to Robert Court. Robert Court.
Thank you, Mr. Speaker. The Royal Navy is providing a pivotal role in providing medical assistance to the British overseas territories. Would the Minister join with me in recognising the dedication and skill of the servicemen and women of RFA Argus, which is providing that medical assistance to the Caribbean?
Minister.
Mr Speaker, I know the Honourable Member for Witney takes a keen interest in defence matters, and I absolutely do agree with him that the Royal Navy continues to provide great service to the territories, particularly in the Caribbean. I also commend the servicemen and women of RFA Argus who are providing vital support to the overseas territories. RFA Argus is boosting the resilience of the territories as they prepare for hurricane season. The FCO and DFID are providing further support to the territories to help deal with the impacts of COVID-19. And in addition, MOD security assistance teams will also be supporting local authorities in some of the territories as they respond to the coronavirus.
Substantive question, John McNally, Minister.
Thank you, Mr Speaker. Hand washing with soap and water, as we are all recognising, is the first line of defence against coronavirus transmission. The UK has world-leading commercial and scientific expertise on water, sanitation and hygiene, and DFID has launched a £100 million scheme with British soap company Unilever to promote hygiene in developing countries, and has given a further £20 million to UNICEF to strengthen its coronavirus response in these areas. We're helping people around the world to defeat this virus.
John McNally. Over to John McNally.
Thank you, Mr Speaker. The International Rescue Committee has highlighted that hand-washing facilities are absolutely crucial in preventing the spread of diseases in the developing world, with our experience of Ebola showing that NGOs currently working on the ground are best placed to scale up an emergency response. So I welcome the funding given to the Red Cross and others, but what plans does the Secretary of State have to increase funding to other local NGOs working within communities?
Minister.
Mr Speaker, food hygiene is the single most effective action an individual can take to prevent COVID-19 transmission. This is an absolutely important point that has been raised. And water, sanitation and hygiene is a key part of DFID's work and vital in humanitarian crises. DFID funds the provision of safe water and sanitation in disaster areas across the globe, and since 2015, DFID has helped over 51 million poor people in Africa and Asia get access to a drinking water supply or toilet for the first time, but we recognise there is still more to do.
Jessica Morden, substantive question, Minister.
Thank you, Mr Speaker. The UK has long been a world leader when it comes to nutrition, which is why I'm looking forward to supporting the Nutrition for Growth Summit later this year. We're working hard to stop poor diets making people in developing countries more vulnerable to coronavirus, and we will not allow malnutrition to exacerbate the crisis. For example, we're working through UNICEF to get life-saving supplies to treat acute malnutrition in children across the Sahel, Somalia, Nigeria and Yemen.
We go across to Jessica Morden. Jessica Morden.
Thank you, Mr Speaker. As the Minister said, malnourished people are clearly at a greater risk of serious health problems due to coronavirus than healthy people. How is DFID specifically supporting its partners to adapt their nutritional programmes in light of COVID-19 and working to minimise disruption to supply chains so we don't see a surge in malnutrition cases?
Minister.
Thank you. This is an important point, Mr Speaker, and we know that for every percentage point contraction in global GDP from COVID-19, we would expect to see, sadly, a result in up to an additional 4 million stunted children, and acute malnutrition is likely to increase. Between 2015 and March 2019, DFID reached 50.6 million women, adolescent girls and young children with nutrition services in 25 countries, and this includes life-saving treatment for acute malnutrition.
I will now call Minister Duddridge to answer the substantive question tabled by Ben Spencer. Minister Duddridge.
With permission, Mr Speaker, I'll group this question with question 12. Keeping supply chains open is essential for British consumers to access what they need. It will also help British business to bounce back quickly. We must protect the lives and livelihoods of people in developing countries that work in those supply chains. So we're working across government within the G20, the World Trade Organization and the World Bank on development-focused trade support, including flows of medical supplies. We're also working with British business to support vulnerable communities overseas that provide goods to the UK.
Spencer.
Thank you, Mr Speaker. Domestic and international supply lines will clearly be crucial to both ours and the world's economic recovery as we bounce back from coronavirus. Is the Minister working with colleagues from the Department of Transport and BEIS to also support logistics firms such as those in my constituency and the vital role they perform in keeping our country running and open for international business?
Minister Duddridge.
Mr. Speaker, I thank the logistics firms across the country, but also particularly in Runnymede and Weybridge, for the work they do. This ministerial team will continue to work with the Department of Trade to keep supply chains open so that firms can restart exporting as soon as the operating context allows. We will also work with the Department of Transport and the Department for Business, Innovation and Skills to understand the impacts on UK logistics firms and the critical role they play in facilitating trade.
Across to Siobhan Bailey. Siobhan Bailey.
Thank you, Mr. Speaker. The pandemic is affecting supply chains across the world at the moment, including those who provide vital goods to the UK and businesses in Gloucestershire. What is my right honourable friend doing to make sure that the work in the affected industries in developing countries are supported during the crisis?
Minister Duddridge.
Thank my honourable friend for that question. We are engaging with businesses in the UK and developing countries to understand the challenges they face to protect incomes and livelihoods. For example, in Bangladesh, through the Better Jobs in Bangladesh programme, DFID will be supporting 1,000 factories and their workers to safely return to work when they're able to do so. We're also urgently examining what funding is needed and how we can have the biggest impact working in partnership with businesses and addressing these issues in the most vulnerable countries.
We now go over to questions to the Prime Minister, but on behalf of everyone in the House of Commons, may I say congratulations to the Prime Minister and Carrie Symonds on the birth of their son. Such happy news amid such uncertainty. 2020 is certainly a year they will never forget. I will call the First Secretary of State to answer the engagement question. I call James Cartledge virtually.
Thank you, Mr. Speaker. And can I join you in sending heartiest congratulations to the Prime Minister and to Carrie on the birth of their son. It's wonderful news, and I'm sure he'll bring them great joy in these difficult times. On coronavirus, surely we should not underestimate the significance of getting to what we hope is the peak of the outbreak without the NHS being overwhelmed. To do that, we've had to take the difficult but unavoidable decision of putting elective surgery on hold for many people. So can I ask, what more can we do to free up the NHS so that our constituents with cancer and other serious non-COVID conditions can start being treated again as soon as possible and in significant numbers?
Both things is engagement. First Minister.
Thank you, Mr. Speaker. I've been asked to reply on behalf of my right honourable friend, the Prime Minister. As members will have seen, as Mr. Speaker has explained, the PM and his fiancée, Carrie Symonds, have announced the birth of a healthy baby boy this morning. Both mother and baby are doing well, and I'm sure the whole House will want to join with me in sending congratulations and our very best wishes to them. Mr. Speaker, the whole House will also want to join me in paying tribute to the 85 NHS workers and the 23 social care workers who have very sadly died from coronavirus. My deepest sympathies are with their family and their friends at what is an incredibly difficult time, and we will continue to do whatever it takes to support them. Mr. Speaker, I'm sure the whole House will also want to join me in wishing Captain Tom Moore, who has done so much, raising £29 million for NHS charities together, a very happy 100th birthday tomorrow. His life of service for his country and his dedication to helping others is an inspiration to us all. Can I thank my honourable friend for his question? And of course, as he notes, it's because we've taken the right measures at the right time that we have flattened the peak of this virus. We have prevented the NHS from becoming overwhelmed. The two single most important elements of this strategy that we've delivered, that has meant the NHS has had capacity to deal not just with COVID-19 patients, but other urgent treatments. And he's also right to say that as we move forwards towards a second phase, we must plan to ensure the NHS is able to deliver elective surgery and treat patients with other conditions, which is exactly what we're planning to do.
I now go over to the Leader of the Opposition, Keir Starmer.
Thank you, Mr. Speaker. Can I add my congratulations and the congratulations of the Labour Party, and I'm sure everybody in this House, to the Prime Minister and Carrie Symonds on the birth of their baby boy. Whatever differences we have in this House, Mr. Speaker, as human beings, I think we all recognise the anxiety that the Prime Minister and Carrie must have gone through in these past few weeks, unimaginable anxiety. And so I really hope that this brings them incredible relief and joy. Can I join with the words of the First Secretary on those that have died on the front line and what he said about Captain Tom Moore, an inspiration to all of us. Mr. Speaker, yesterday, an important set of figures was published about the deaths from coronavirus. First, the deaths in hospital, currently at 21,678. That's the number that's published every day. On top of that, yesterday, we saw the CQC figures for deaths in care homes for the 2 weeks ending last Friday. That was a figure of 4,343. And at the same time, the ONS figures came out for deaths outside of hospitals, outside of care homes, and that was a figure up to the 17th of April of 1,220. There's a bit of a complication because of the different dates, but that makes a total to date, Mr. Speaker, of 27,241 recorded deaths from coronavirus. And that's probably an underestimate because of the time lag. Behind each number, of course, is a family shaken to its foundations. Now, 6 weeks ago, on the 17th of March, the government's chief scientific advisor indicated that government hoped to keep the overall number of deaths from coronavirus to below 20,000. He said that would be good, by which, in fairness to him, he meant successful in the circumstances. And we're clearly already way above that number. And we're only part-way through this crisis. And we're possibly on track to have one of the worst death rates in Europe. On Monday, the Prime Minister said in his short speech that many were looking at our apparent success in the United Kingdom. But does the First Secretary agree with me that far from success, these latest figures are truly dreadful?
First Secretary of State.
Thank you, Mr. Speaker. Well, first of all, can I welcome the various points of solidarity between our front benches in relation to, of course, the new baby boy for the Prime Minister and Carrie Symonds, but also in relation to care workers and NHS workers who have lost their lives. He's right that there is a challenge in deciphering the difference between the different figures because of the time lags in relation to the care home deaths. Equally, I know it's something that on all sides we have wanted to deliver, which was clearer breakdown and distinction between care home deaths and deaths in the NHS, and I think that is progress. He mentioned the target of 20,000. Of course, this is an unprecedented a pandemic, a global pandemic, and I think in fairness we shouldn't criticise either the CMO or the Deputy CMO for trying to give some forecast in response to the questions that many in this chamber and indeed in the media are calling for. But the reality is we know a lot more about the virus, both domestically and internationally, than we did before. I absolutely share his, I guess, our joint horror at the number of deaths. Tragedies, each and every one. Equally, I'm going to disagree with him that it is far too early to make international comparisons on a per capita basis. And I think we're already seeing that there are different ways that deaths are measured, not just in the UK in the different settings, but across Europe and across the world. And of course, this is a very, as I've said, delicate and dangerous moment in this pandemic, which is why, with the greatest respect, I think we do need to wait until we've got further evidence from SAGE before moving towards a transitional phase or a second phase. And it would be irresponsible right now and to start setting out in detail what proposals we might come up with in advance of having that advice from SAGE.
Keir Starmer.
Thank you, Mr. Speaker. Can I be clear? I wasn't criticising the experts. I was pointing out the difference between what had been hoped for and where we'd got to. I do welcome the clearer breakdown of figures, which I think we're going to get from this afternoon onwards. I also welcome the fact that it appears, and I hope this is right, that the number of hospital admissions are going down and the number of deaths from coronavirus in hospitals are going down. We've all been looking at those graphs, and I hope that is continuing in the right direction. But from yesterday's data, it appears that that just isn't the case in care homes. They show that deaths in care homes appear to have been rising even while hospital deaths have been falling. And that's on the back, as the First Secretary knows, of concern for some weeks from the front line about testing in care homes and the speed of testing, about concerns about protective equipment and arguments that it's been too slow. We've all heard from the front line in the care sector expressions of real anxiety about the situation that they find themselves in. So can the First Secretary explain why he thinks that coronavirus continues to spread so fast in the care sector? And returning briefly to something from last week, but I think the First Secretary has already touched on it, could he give us the up-to-date figures for the number of those that have died on the front line in the healthcare staff and the number of social care workers? I raised it last week. I think he's given a figure, but just to confirm that.
First Secretary.
Well, can I thank the right honourable gentleman? I have already given those figures, and they are, of course, produced in the normal way, and he will be appraised of them just as he is in relation to the other figures. It's absolutely right to say that there is a challenge in care homes. In fact, when SAGE produced their advice and when the Chief Scientific Advisor and the Chief Medical Officer gave their 3-weekly review several weeks ago now, it was made clear that we had made good progress overall in reducing the level of community transmission, but there were still challenges both in hospital settings but also specifically in care homes. There are real challenges in care homes. The principal challenge in care homes, unlike in the NHS setting where we've made such good progress, is the greater challenge from a decentralised basis in terms of exercising control over the ebb and flow of people into those care homes. That includes residents, it includes care home workers, which sometimes work in different care homes. It also includes NHS workers and, of course, friends and family. That is the single biggest challenge in terms of reducing transmission. But I hope I can reassure him that we have a comprehensive plan to ramp up the testing in care homes. The eligibility was changed yesterday by the Health Secretary, to overhaul the way PPE is delivered to those in the front line, and we're also expanding the workforce by 20,000 through a new recruitment campaign. But there is no doubting, Mr. Speaker, and I will not shy away from saying in front of the right honourable gentleman that this is a challenge, but it is a challenge that we must grip and that we can grip to make sure that those in care, we can get the numbers down in care homes, as we've seen in hospitals and as we've seen in the country at large.
Keir Starmer.
Thank you, Mr. Speaker. Just on the back of that answer, I think on the MAR programme on Sunday, the First Secretary said that deaths in care homes were falling in line with those in hospitals. That doesn't appear to be borne out by the figures, unless there are some figures we haven't seen. I just wonder if the First Secretary could take a moment to clarify that when he next gets up. Yesterday was Memorial Day for all those who lost their lives at work. And it's really important that we honour and remember all those who died, whether from coronavirus or from anything else. But it's also important we redouble our commitment to protect all those at work. And that's why protective equipment for the front line is so crucial. Now, I recognise the challenge the government faces on this. I recognise that getting the right piece of equipment to the right place every time is very difficult. But lives do depend on it. And it is 10 weeks since the Health Secretary declared that there was a serious and imminent threat to life. And you'd hope that by now things will be getting better, not worse. Yet a survey of the Royal College of Physicians, published on Monday, reported that 1 in 4 doctors are still not getting the protective equipment that they need. And the RCP president was quoted in these terms, his words on Monday: "It's truly terrible that PPE supply has worsened over the last 3 weeks rather than improved." Now, I know that's not where the First Secretary or the government want to be, with indications from the front line that things are worse, not better. But he must recognise this is a plea from the front line. So can I ask the First Secretary, what's going on and how soon can it be fixed?
First Secretary.
Can I thank the right honourable gentleman? First of all, in relation to the care home data, obviously we've seen the latest data come out. There are some positive signs, but I think they're frankly within the margin of error, and we need to be very focused that there is a challenge in care homes and we've got a plan in place to grip it. So there's no sugarcoating that issue. I take exception with him suggesting that things are getting worse, not better. That is not true overall. We have shown through the social distancing measures the overwhelming commitment to them by the public and our efforts to ramp up capacity, particularly ventilator beds, critical care capacity in the NHS, that the two central limbs of our strategy, which is to flatten the peak that we're going through, which if we hadn't done, the death toll would have been even worse, and also to make sure that the NHS ability to cope, those two critical elements of the strategy have worked to date, and it's absolutely important that we keep up the effort on all of that. In relation to PPE, again, he must, when he addresses this, recognise that we face an international, a global supply shortage. Every country, when I pick up the phone as Foreign Secretary and I speak to leaders, foreign ministers, counterparts around the world, are facing this. And we are now the international buyer of choice. We have had 22 flights of PPE and ventilators from China just this month, in the last week, over 1.5 million masks from China, 3 flights from Turkey with gowns and face protection, 140,000 gowns from Myanmar, and we brought in Lord Dayton, the Noble Lord from the other place, Lord Dayton, to ramp up our domestic production, supply and distribution. So he's right, there is challenges on the front line. There's no minimising or sugarcoating any of those cris de coeur that he mentioned. I feel animated, inspired to do even better, but he needs to recognise on PPE that there is a global supply shortage, and we're doing absolutely everything we can to make sure that those on the front line get the equipment that they need.
Keir Starmer.
Thank you. I do recognise the efforts that are going on. The First Secretary says he takes exception to what I said about things worsening. I've tried not in this to base anything on my own personal opinion, because I don't think that's helpful. What I was quoting was the Royal College of Physicians, those on the front line. So it's not my view, it's their view. And I've tried to be careful to stick to the data and the evidence rather than just coming up with an opinion. Can I ask the First Secretary about testing? Now, it's clear there's been an increase in testing in the last week and since we were last at the dispatch boxes, and I welcome that. And yesterday, the government announced further extension and expansion of testing, and I welcome that as well. But there are obviously still significant problems. The government reported figures for Monday show a capacity to test of 73,000, which has gone up. It's the highest it's ever been. But only 43,000 actual tests were carried out. And when you drill down into the figures, only 29,000 people were actually tested. So the number of people tested was 29,000. Now, last week, the First Secretary said the problem was not capacity, but there was a lack of demand. I wasn't convinced, to be honest. But now we know demand's gone through the roof. We know sites were unable to cope with the numbers of people trying to book tests. So obviously demand isn't the problem. Yet on Monday, 30,000 tests that were available weren't used. Now, I'll have to recognise that the 100,000 a day by Thursday was only ever a staging post, and perhaps the exact date doesn't matter as much as some would think. On the March the 12th, 7 weeks ago, the Prime Minister made clear his plan, and his plan was to ramp up daily testing to 250,000 tests a day. I agree with him on that. I think that's the scale we should be at. So can the First Secretary clarify that the 250,000 tests a day is still a government target, and if so, roughly when he thinks the government will hit that target?
First Secretary.
Can I, Mr. Speaker, and I thank the right honourable gentleman, just on this issue of things getting worse. I understand the point he wants to make about PPE. It's an absolutely valid point, but I don't think it should be elided into the broader critique that overall things are getting worse. As we come through the peak of this virus, we start to get deaths down. We've got to focus on driving them down even further, and in particular making sure that we don't risk a second spike by increasing the transmission rate. And I think the right honourable gentleman could take time just to recognise our success on social distancing and critical care capacity, which has allowed that to happen. On testing, we now have 73,400 tests capacity every day. That is almost double from the point at which we were at the dispatch box last week. On daily tests carried out, the figure is now 43,563, which is up from well over double the 18,000 from the point at which we were at last week. In relation to capacity and demand, when we talk about demand, when the NHS talks about demand, they're talking about the numbers of tests actually carried out, people not just being willing to come forward, but actually being able to come forward. And what we've done to make sure that we ramp up the testing as swiftly as possible possible, is not just the extension and the widening of eligibility last week, but we've gone further and we've now said anyone who needs to go to work and says that they can't just work remotely and they have symptoms, we will widen the eligibility to them. Anyone over 65 with symptoms will also be able to action those tests. And of course, it will be, and it comes back to his earlier point, available to all care homes, all care home residents as well as staff, whether they're symptomatic or not. This is incredibly important. We are on track to make huge progress. And of course, he's right to say that the 250,000 target is still an aspiration. I'm not going to put a date on it, but the key point is the 100,000 milestone. Very important to me, we're making good progress, is only the first stepping stone towards testing, which is essential to the wider testing, tracking and tracing regime we'll need as we transition to the second phase.
Can I just gently say to both front benches, we're really going to have to put some speed up, so we'll not get anybody else in today. Keir Starmer.
Thank you, Mr. Speaker. The First Secretary invites me to recognise the good work on social distancing and on critical care capacity. Can I do that unreservedly? It's been an amazing piece of work, particularly the ramping up of capacity, and I send my thanks to all of those that have been involved in it. I'd absolutely recognise it. Mr. Speaker, the reason I've raised these issues is because they're vital to controlling the virus, protecting lives, and so that we can get to an effective exit strategy. The public need to know what's going to happen in the next phase. And on exit strategy, I want to be absolutely clear with the First Minister. I am not asking for lockdown to be lifted. We support the government on lockdown and will continue to do so. So I'm not asking for that. I'm not asking for a time frame. The government says it can't give a time frame. I accept that and we support the government on that. I said I wouldn't ask the impossible and I won't. What I'm asking for is the government to be open with the British people about what comes next. That's crucial for three reasons. We need their trust. Secondly, the government itself, the public, schools, businesses, trade unions need to plan ahead. And they're saying that loudly and clearly. Third, and frankly, we'd like to try and support the government strategy when we know what it is. I think it's important for us to do so if we can. We can't do that if the government won't share its thinking. The Prime Minister said on Monday that he wanted maximum transparency. Will the First Secretary give us some now and tell us when the government will publish an exit strategy?
First Secretary.
Can I thank the right honourable gentleman? I'll just remind him that, as I set out on the 16th of April, SAGE advised against any changes to social distancing measures at that point. The reason is that they would risk a substantial increase in the infection rate. SAGE is reviewing the evidence again in early March. He's asked for a time frame and a date. We can't give it until we have the SAGE evidence. If he thinks there's things that we could be announcing, whether it's along workplace, which you referred to, schools or otherwise, feel free to propose those things. But I would just gently say that based on the advice and the evidence that we had from SAGE, which he said he wants to closely follow, it would be very difficult for us to responsibly set out those proposals before we've had that subsequent advice from SAGE, both on the rate of infection, the death rate, but also the measures it would be responsible to make. And that is why, with the greatest respect, and I understand he's trying to be constructive, we can't be pulled in to making proposals in advance without SAGE opining.
Keir Starmer.
Mr. Speaker, the problem with the First Secretary response is that it risks the UK falling behind. France, Germany, Spain, Belgium, New Zealand, Australia, Scotland and Wales have all published exit plans of one sort or another. The First Secretary said, well, what are the proposals? What should they cover? If you look at those plans, as he's done and I've done, it's clear that there are common issues such as schools reopening, business sectors reopening. These are the issues that, if he wants me to put them on the table, I absolutely will, because they're clearly the issues that need to be addressed. There will be other issues, of course, but delay risks not only falling behind other countries, but also the successful four-nation approach so far. We want to support the government on an exit strategy. We want to support the four-nation approach so that we can all exit across the UK at the same time and hopefully in the same way. So I asked the First Secretary if the government will work constructively and openly with the opposition on the question of what happens at the next stage.
First Secretary of State.
Can I thank the Right Honourable Gentleman? We certainly will engage, and I've enjoyed the telephone calls with opposition leaders, including himself. But can I also just gently say that if he's suggesting that we can set out concrete proposals now, despite clear evidence and advice from SAGE, that we should wait for their review of evidence in the next week or so, I would gently say that is the wrong thing to do. And if he thinks he knows better than SAGE and the scientists that have suggested that, he needs to explain it. He talked about the Scottish Government. The Scottish Government have not set out an exit strategy. I read through very carefully their 25-page document. It was eminently sensible, and it was grounded in the 5 tests that I set out on the 16th of April. He talked about some of the other European countries, but he will know, because I know he's an assiduous follower of the international evidence, that Germany is now having to think twice about easing up on the measures because of the risk of a second spike. This is exactly the risk that the Governor of the Bank of England referred to last week, that I referred to on the 16th of April, and that SAGE and the scientists have been referring to. And I just, again, the Right Honourable Gentleman is trying to, and is succeeding in engaging in a very constructive way. He has a strong professional reputation when he was DPP for being guided by the evidence. That is much to his credit. Can I just gently say he shouldn't abandon that rigour now?
So Desmond Sway.
Will garden centres and nurseries be allowed to reopen in short order?
First Secretary.
I thank my Right Honourable friend for cutting straight to the chase. I totally appreciate the value of garden centres and nurseries. The current advice, as I've indicated from SAGE, was that relaxing any of those measures, including the ones that he refers to, would risk damage to the public health, our economy, and frankly the progress that we've made, the sacrifices so many have made, the lives that have been lost. But can I reassure him that they looked specifically at garden centres, and we will continue, as I've indicated earlier, to keep the evidence on each individual measure under very close review.
We go across to the Leader of the SNP, Ian Blackford. Ian Blackford.
Thank you, Mr. Speaker, and can I send my congratulations to the Prime Minister and to Carrie Symonds on the birth of their son, and long life and happiness to the newborn. Mr. Speaker, we are 2 months away from the deadline on approving an extension to the Brexit negotiations. Michel Barnier has been clear. The UK is refusing to engage seriously on a number of fundamental issues. The government is shamefully gambling our economic future with a no-deal Brexit in the middle of a health emergency. Why is the government threatening to isolate our economy at the end of the year during the biggest economic crisis of our time?
First Secretary.
Can I thank the Honourable Gentleman and join with him in sending those messages of goodwill to Carrie Symonds and the Prime Minister, and of course their new baby boy. I'm not sure I'd be quite taking the word of Michel Barnier for the state of progress in the negotiations quite as readily and as uncritically as the Honourable Gentleman has, but let's be very clear about it. Our position is unchanged. The transition period ends on the 31st of December. That is enshrined in law. There's no intention of changing that, and actually what we should do now, given the uncertainty and the problems and the challenges coronavirus has highlighted for us, but also for our European friends, and I've worked extremely closely with our German, French and all of our other European partners, is focus on removing any additional uncertainty, doing a deal by the end of the year, and allowing both the UK and the European Union and all of its member states to bounce back as we come through the coronavirus.
Ian Blackford.
Thank you, Mr. Speaker. What we should be doing is removing uncertainty, and we should be putting a stop to these talks. We should be making sure that we protect our businesses, and the failure by the First Secretary to rule out a no-deal Brexit should alarm us all. Mr. Speaker, the World Trade Organization predicts that world trade may fall by 32% this year. The IMF says the global economy will suffer its worst financial crisis since the 1930s, and the OBR warns that the UK economy could shrink by 35%. That means 2 million people are at risk of losing their jobs. Refusing to admit the inevitability of an extension isn't a tough or a clever negotiating tactic. It's a reckless and a foolish gamble. Will the Secretary of State embrace common sense and recognise the need for a Brexit extension, show some leadership, face down the hardliners in the Tory party, extend the Brexit transition, and let us all get on with the job of tackling this health crisis together?
First Secretary.
Can I thank the honourable gentleman? So first of all, if his desire is to avoid more uncertainty, then the right thing for us to do is double down, get a deal by the end of this year. If his desire is to dig ourselves out of the economic challenges that we, the European Union, the world face, then the answer isn't to engage in protectionism, but to do this deal, give a shot in the arm to businesses on both sides of the channel, and that is what we're absolutely wholeheartedly focused on doing, and we're doing it as one United Kingdom.
Rob Roberts.
Thank you, Mr. Speaker. The company programme run by the charity Young Enterprise provides the opportunity for young people to apply their skills in real-world situations, working in teams to set up and run their own Young Enterprise company. My right honourable friend agree with me that providing financial education in our schools is a vital way of empowering young people and ensuring that we're able to further our Levelling Up programme across the whole country when we come out of this crisis.
Mr. Secretary.
Can I thank my honourable friend for raising this excellent programme. He's absolutely right. A strong understanding of numeracy underpins a young child's ability to manage money, for example, by calculating percentages or doing divisions. And this government's reforms have made a step change in progress for numeracy and literacy for those young children. That needs to be backed up by the practical applications, and many organisations that support schools with financial education are adapting their programmes, and I think Young Monies is an excellent example of that.
We go over to Alan Dorans. Alan Dorans.
Thank you, Mr. Speaker. Will the First Secretary of State make a commitment today that when a vaccine for COVID-19 becomes available, the United Kingdom will take a leading role, together with other nations, to ensure it is distributed according to the needs of people across the world, rather than on the basis of wealth?
First Secretary.
Well, can I thank the honourable gentleman? He's absolutely right. And we, as the Health Secretary announced, we've had trials announced very recently. We are taking a lead in the research and development, but he's also right to say, as my right honourable friend, the Development Secretary announced, I think, earlier in questions, we're also contributing to Gavi and CP, which is the international effort to make sure we can ramp up not just the international effort to find a vaccine, but to make sure that not only can we vaccinate all of the people here in the UK, but also in the most vulnerable and poorest countries around the world. And so I entirely agree with what he said.
Robert Courts. We go over to Robert Courts.
Thank you, Mr. Speaker. The government has pulled out all the stops in providing a range of timely financial support for businesses. But both as the chair of the Small Business APPG and in West Oxfordshire, I hear reports of businesses that are being denied help by banks that are falling behind regulatory systems rather than concentrating on the urgent need to get cash out of the door to the businesses that need it. Would my right honourable friend agree with me that as the nation makes sacrifices unheard of in peacetime, it's also time for the banks to do their bit?
First Secretary.
Can I thank my honourable friend, pay tribute to all he's doing to champion small businesses. We want to help all businesses, small, medium, and of course the large ones, in Witney and across the country, get through this incredibly difficult period and bounce back with confidence as we defeat the coronavirus. Through the Coronavirus Business Interruption Loan Scheme, through the Large Business Interruption Loan Scheme, and the Bounce Back Loan Scheme, we're lending to businesses of all shapes and size. And the government has stepped up to the plate, and he's absolutely right that we expect the banks to do the same too.
We go across to Zara Sultana. Zara Sultana.
Thank you, Mr. Speaker. While working people are having to make huge sacrifices through this crisis, state support is available to big businesses that dodge taxes and pay millions to super rich executives and shareholders. Mr. Speaker, we should be bailing out the 99%, not the 1%. So will the government follow the likes of Denmark and stand up to big businesses by saying, if you want state support, you have to prohibit dividend payments and share buybacks, and you can't be based in a tax haven?
First Secretary.
Okay, I thank the honourable lady. I have to say, I think if she looks at the package of measures that my right honourable friend, the Chancellor, has put in place in the round, she will see that not only are we dealing with small businesses, we're also helping those larger businesses, and they're important too. They're large employers, and we're doing everything we can to support innovative firms, which will now benefit from the offer of £1.25 billion, which is for high growth firms. So I think we should take, frankly, some of the partisan baggage out of this, focus on targeting the businesses businesses that will create the growth, which will drive us through this crisis and support the workers up and down this country who rely on those crucial businesses.
We go across to Robert Largan. Robert Largan.
Thank you, Mr. Speaker. The current crisis has shown just how important it is to have sufficient urgent care capacity in the NHS. I've been campaigning for new urgent care centres at both Stepping Hill Hospital and Tameside Hospital to help NHS staff provide world-class care to people in High Peak and across the region. Can the First Minister assure me that the government remains committed to building these badly needed new urgent care centres?
First Secretary.
Well, can I thank my honourable friend for the way he is championing the NHS in the tenacious and doughty way. I'm delighted that Stockport NHS Foundation Trust have been allocated close to 31 million for the provision of a new emergency care campus at Stepping Hill, one of our 20 hospital upgrades. And Tameside and Glossop Integrated Care NHS Foundation Trust have also been allocated over £16 million to provide emergency and urgent care facilities at Tameside General Hospital. Conservatives are the party of the NHS with more money, more hospitals, more doctors and nurses, and that's one of the reasons we've managed through our critical care capacity to help protect the NHS from becoming overwhelmed by coronavirus.
Wes Streeting.
Thank you, Mr. Speaker. Can I, first of all, offer my deepest thanks to first responders from the Metropolitan Police and the London Ambulance Service who were greeted with a horrifying scene on Sunday night of an 18-month-old baby girl and 3-year-old boy brutally murdered in their own homes. There are no words of comfort that we can offer their grieving mother, but what the government can do is to do more to support people who are not safe in their own homes. I recognise the £3 million that's gone in to support children who witness domestic abuse and the £2 million that's gone in to support the domestic abuse hotline, but it's not enough and it's not quick enough. So in that spirit, can I ask the First Secretary of State to commit to providing the £75 million ring-fence fund that the Shadow Home Secretary has called for, so that in these darkest of times for people who are trapped unsafe in their own homes, they know that support is available.
First Secretary.
Can I thank the honourable gentleman and first of all say how appalled I am at the tragic case in his constituency. I pay tribute to the frontline emergency responders, but I absolutely, in total solidarity with the honourable gentleman, want to pass my condolences to the family around that terrible case. It sounds absolutely appalling. The police have been very clear that they will pursue perpetrators and anyone in immediate danger, and they should call 999. We're going through the coronavirus challenge. It's put pressure on the police, but they are there to do that incredible job that they do day in, day out. We do have the National Domestic Abuse Helpline staffed 24 hours a day. We're supporting charities and others supporting victims of domestic abuse with £750 million. He makes some interesting points about what more we could do. We're constantly looking to reinforce and strengthen the challenge of the response to domestic abuse, and he's right that there is a specific issue around it in relation to this crisis. The domestic abuse bill had its second reading yesterday, and that will help take our response to the next level, and also is an opportunity for him to make further proposals in due course.
Shirley Schwab.
Thank you, Mr. Speaker, and may I join in the congratulations to the Prime Minister and Carrie Symonds on the birth of their son. Mr. Speaker, I was recently speaking with a lady who, very sadly, lost her husband in hospital to COVID-19. She spoke of the fantastic care given to her husband by the NHS staff, but she also spoke of the incredible support that she and her family received from those same NHS workers. Would my right honourable friend join me in congratulating the NHS staff not only for caring for those who are ill, but also for the wonderful support they give to their loved ones?
Mr. Secretary.
Can I thank my honourable friend? Can I first of all pass on my very deepest condolences to the widow in his constituency. I, along with other ministers, have the grim task of reading out the total death toll at these press conferences, and I always walk away ashen-faced at what this must mean for individual families up and down the country. He's right to pay tribute to the NHS, who are doing an amazing job, and we've, all of us, I think, across the House, paid tribute to them and the care workers with our minute's silence in particular yesterday. But I think he's absolutely right also to say that they're not just there to treat the physical condition, whether it's of coronavirus or otherwise. They do an amazing job as providers of emotional support for patients and their families, and I think that's something which is too easily overlooked as we come through this crisis.
Going over to Geraint Davis. Geraint Davis.
Mr. Speaker, the UK opted out of the EU joint procurement of PPE, ventilators and medical equipment. Can the First Secretary confirm that whether this was a political or commercial decision, and take this opportunity to say that we will take any future opportunity to join any EU scheme that helps to safeguard supplies to our NHS in order to avoid any preventable deaths in our communities or in the NHS or care services?
First Secretary.
Thank the honourable gentleman. I mean, as you'll know, because it's been made clear by the government and clarified when it wasn't clear, the original issue was a failure of communication. We didn't get the original invitation to tender, if you like. It's very clear to us that the schemes in relation to the first batch of EU-wide procurement would not have made any significant extra difference or added any value to what we're doing here. I can tell him that we will look at any future procurement-wide initiatives, for example, on therapeutics. I can also just reassure him, one of the things that we're doing is working very closely with our European partners on returns and repatriations, and that's something where we have taken advantage of EU-wide schemes if it can help us share costs, and that's the collaborative internationalist approach that the UK government takes.
Mark Pritchard.
The sector is vital to Shropshire's economy, employing thousands of people, and notwithstanding his earlier response to my right honourable friend, can I ask that in any economic unlock, that in phase 1, that garden centres and nurseries, seasonal nurseries, will be allowed to open, albeit with careful and considered strict guidelines?
First Secretary.
I thank my honourable friend. Second plea for garden centres and nurseries is absolutely right, and I understand entirely why it's so important, both economically but also socially, particularly for certain members of our community for whom it will be an important means of getting outdoors and getting out of the lockdown. We will, Sage has already considered it once. I know it will consider garden centres and nurseries again, and I know he will expect us to continue to be guided by the evidence, but he has made his point in a powerful way, and it's certainly very firmly registered that this is an important area for us to look at for the future.
Alex Cunningham. Go over to Alex Cunningham.
Thank you, Mr. Speaker. There's never been sufficient nursery places to meet the extra demand created by the Child Care Act 4 years ago, and now things are set to get worse. I've received a huge number of emails from local nursery managers and workers angry at the government for failing to take action to protect early years workers during the coronavirus crisis because they're not entitled to access the furlough scheme. What will he do to sort this out and ensure that these nurseries still exist once the crisis is over?
First Secretary.
Well, this is a hugely challenging time for nurseries as it is for schools and other small businesses. The Chancellor has set out the range of support that's available. It's widespread. It covers all sorts of different areas. But of course, in relation to nurseries or any other sector that is finding the challenges too much to bear as we go through this crisis, we will of course make sure we look at them afresh and see what further can be done.
Saqib Bhatti. Over to Saqib Bhatti.
Thank you, Mr. Speaker. I'd like to begin by echoing the congratulations that have already been given to the Prime Minister and his fiancée on the birth of the baby boy. I hope they're all in good health. Mr. Speaker, over the weekend, there was a double stabbing in my constituency. In light of this, will my right honourable friend join me in calling on the Police and Crime Commissioner to reverse his decision to close the local police station? And what reassurances can he give the House that as we emerge from this lockdown, we are protecting our communities from the scourge of knife crime?
First Secretary.
I thank my honourable friend, and it's a tragic but timely warning that some of the persistent social challenges that we face around knife crime or any other kind of crime will persist and not just stay at home because of coronavirus, although overall the level of crime has come down. Can I pay my very deepest sympathies with the families of the victim in his constituency, and can I reassure him we've committed to recruiting 20,000 more police officers over the next 3 years. We're making it easier for the police to exercise stop and search powers. We're ensuring that more perpetrators go to prison and for longer. He will know that it's for PCCs to decide on how and where to spend their resources, but I pay tribute to him for being a tenacious and doughty champion for the crime issues and the policing that needs to take place in his constituency.
We go over to Alison Thewlis. Alison Thewlis.
Thank you, Mr. Speaker. Many businesses in my constituency and around the UK shut their doors on public health advice, and they're now finding that insurers are refusing to pay out on business interruption policies. So I ask again, will the UK government intervene and stand behind these claims so that no business loses out for doing the right thing?
First Secretary.
And I thank the Honourable Lady. I don't think it's the right thing to do to stand behind all of the claims, but we certainly do and continue to liaise with the insurance industry to make sure, as far as is legally and practically possible, they're showing the flexibility as people and particularly the consumers of those insurance policies come through this very difficult time.
We go over to David Mundell. David Mundell.
Mr. Speaker, I'm absolutely delighted to be able to connect with you this week. I've finally escaped from the Zoom waiting room, and in so doing, I can pass my congratulations to Carrie Symonds and the Prime Minister on the birth of their son. Mr. Speaker, I have a large number of haulage companies in my constituency, and I'm sure the First Secretary will recognise that lorry drivers are key workers during this crisis, transporting goods across our United Kingdom. However, many have struggled to access hot food out with their cabs, even to access toilet and shower facilities. So can the First Secretary ensure that we're doing all that we can to support lorry drivers as they carry out their important duties during this crisis?
First Secretary.
I thank my right honourable friend and say it's always good to see him, even via Zoom, or especially via Zoom. Can I thank all of the HGV and delivery drivers for all that they're doing in the country to keep us going. And I think across the House we'd probably agree that our view and our definition of key workers has changed as we come through this crisis, and there is an appreciation of people doing those gritty jobs day in, day out, and quite the extent to which we rely on them. All motorway service stations in England currently remain open to road users. That is why the Transport Secretary is continuing, based on the concerns he's rightly raised, to work with motorway service operators to ensure as many facilities within those individual service stations remain open as possible, to make sure HGV drivers can take a break and use whatever facilities they need before they go back to work. And he raises an excellent point.
Dave Dugan. Go across to David Dugan.
Thank you, Mr. Speaker. The Chancellor said of his COVID-19 response that we will not leave you behind, we all stand together. He then delivered a financial package that did leave behind hundreds of my constituents in Angus and thousands more across these islands by a government who will refuse to introduce a universal basic income, just like my constituent in Arbroath, who could not be furloughed by his former employer, and because of Treasury rules, neither can he be furloughed by his new employer. So now, after 44 years of working, he's been cut adrift as collateral by this government. What is the First Secretary's advice to my constituent?
Well, can I thank the honourable gentleman and just say to him, we don't support universal basic income, mainly because given our precious resources at such a challenging time, it wouldn't target it at those who need it the most. In total, Scotland will receive a cash boost over £3 billion to tackle the coronavirus. So the financial support from the UK government is going there. That's on top of the UK military support with things like mobile testing and the airlifting of patients from some of the island communities in Scotland. And we're also expanding testing capacity right across the UK with centres recently opened in Glasgow, Aberdeen and Edinburgh. We'll get through this crisis and we'll do so as one United Kingdom.
Dame Cheryl Gillam. Dame Cheryl.
Thank you very much, Mr. Speaker. Can I associate myself with the remarks of the First Secretary and send congratulations to the Prime Minister and Carrie? Research from the All-Party Parliamentary Group on Autism found that before the coronavirus crisis, more than 2 in 3 autistic adults were not getting the support they needed. Sadly, in some areas, emergency powers to ease duties under the Care Act have had to be triggered. Can my right honourable friend guarantee that autistic people will not be disproportionately affected by these changes? And will he publish which councils have to resort to emergency powers?
First Secretary.
And I thank my right honourable friend. She raised a really important point. And of course, we want to make sure all autistic children or any other children with special needs going through this terrible crisis are as protected as we possibly can. I think when it comes to looking at the future arrangements for schools, on top of the key workers, we've got to make sure that we do as much as we can to protect vulnerable children, and particularly those with particular needs. She talked about the funding going through to local authorities. Allow me to take that back, speak to both the Education Secretary but also the Community Secretary, and make sure that we can come back with a specific answer on the particular points she raised.
Last and final question. We now go over to Sir Geoffrey Donaldson. Sir Geoffrey.
Thank you, Mr. Speaker. Could I, on behalf of the Democratic Unionist Party, echo and pass on our congratulations to the Prime Minister and Carrie Symonds on the birth of their son. The headline in this morning's Belfast Telegraph speaks about deaths for people who are not infected by the virus, people who have not been attending hospital and who desperately needed treatment. Will the First Secretary advise us of the measures the government intends to take to address this issue and to ensure that more people are able to attend for treatment, including cancer patients?
Secretary.
Can I thank the Honourable Gentleman and pay tribute to all the work he is doing, and indeed the Northern Ireland Executive at this difficult time. He's absolutely right to raise the challenge within the NHS more generally of dealing not just with COVID-19 but the wider conditions that people have. The Chief Medical Officer has made it very clear we have the capacity, the plans that we put in place and that we delivered through the Nightingale hospitals, the ventilators, the critical care capacity is in place not just to deal with coronavirus but also to deal with other non-COVID priorities, whether they're urgent or whether they're other forms of treatment in relation to cancer or otherwise. And I'm certainly very willing to work with the Health Secretary and the Northern Ireland Secretary to make sure in relation to any particular challenges faced in Northern Ireland that we can deal with them and address them. And it's absolutely crucial as we go through this crisis that that NHS capacity is protected. And that's one of the reasons we introduced the social distancing measures and why it's so important that they've been so effective.
That is the end of Prime Minister's questions. We're now going over to a statement on repatriation of UK nationals affected by COVID-19. I call Minister Nigel Adams to make the statement, and he's got up to 10 minutes to do so. Minister Nigel Adams.
Thank you very much, Mr. Speaker. With your permission, I would like to make a statement on the Foreign and Commonwealth Office's response to the COVID-19 pandemic. Our team of experienced diplomats here at home and in our embassies and consulates around the world continue to work around the clock using our unparalleled international connections to help overcome this unprecedented challenge. Now, since the outbreak in Wuhan, Mr. Speaker, our overriding priority has been to help British travellers get home safely to their loved ones. And we estimate that over 1.3 million people have returned to the UK since the outbreak via commercial routes. Now, this has been from countries across the globe. We've seen 200,000 British nationals return from Spain, and 50,000 have returned from Australia in the past month alone. Keeping commercial options running has required an enormous international effort. We've worked alongside airlines and foreign governments to keep vital routes open and ensure that domestic restrictions don't create a barrier to getting people home. But as you will appreciate, Mr. Speaker, as countries have increased travel restrictions, often without notice, commercial routes have ceased to be an option for some travellers. So thanks to a £75 million partnership between this government and airlines, we have now brought back more than 19,000 people on 93 charter flights organised by the Foreign Office from 20 different countries and territories. And in some instances, this will mean bringing home a few hundred passengers from small countries like the Gambia or remote locations like the outer islands of the Philippines. In other cases, this has meant returning thousands of British travellers, such as the 10,000 people returned home from India and 2,000 thus far from Pakistan. In the next week alone, we will bring back thousands more travellers on further charter flights, including from Bangladesh, Nigeria, and New Zealand. Mr. Speaker, I'd also like to touch on cruise ship travel. More than 19,000 British passengers were aboard 60 cruise ships when the FCO changed their travel advice on the 17th of March. And working with those local authorities and governments and the cruise operators, the FCO has helped ensure these passengers were able to return home. We've provided consular assistance to many of them, and in some cases we've organised direct or supported charter flights for over 1,500 people. But for those people who have chosen to remain in place or are still trying to get home, our consular teams are providing support 24 hours a day. To ensure timely responses, we've tripled the capacity in our consular contact centres. Our broader consular effort has been centred around supporting British travellers right across the piece. We've worked with foreign governments to ensure that British travellers can continue to meet visa, immigration or documentation requirements while they're abroad, and we're offering financial protection as well, including through the same measures available to British workers and residents here at home, such as the Coronavirus Job Retention Scheme and access to mortgage holidays. We're making sure that British travellers have access to essential care, including food and accommodation, as well as medical care. This also includes psychosocial support, and we've been working with third sector and external partners to deliver this. And now, most UK insurers will extend their travel insurance cover, so British travellers actively trying to get home will be covered for emergency medical treatment if they're still stuck abroad for at least 60 days. Our efforts and our aims show that we're committed to helping every British traveller, no matter where they are in the world. And Mr. Speaker, I'd now like to turn to the FCO's role in procurement, particularly and specifically on PPE equipment. With so many other countries in similar circumstances, we are grappling with a global shortage in personal protective equipment. Yet thanks to the efforts of our domestic manufacturers and our work with international partners around the world, we've procured and distributed over 1 billion items to those on the front line. Lord Dayton, who helped organise the London Olympics, has been brought in to oversee efforts to boost our domestic supply even further. And in the Foreign Office, we're working tirelessly through our overseas posts to get medical supplies into the UK. Mr. Speaker, over 350 million items of PPE equipment have been procured through our China network alone, and we're working flat out to get orders delivered from, for example, Turkey and Egypt. We've also distributed over 1,500 ventilators, with thousands more ordered and on the way. And in the last week, we've received shipments of more than 4 million IIR masks and 1 million other masks. And by the end of today, flights will have touched down with more than 500,000 masks, more than 350,000 gowns, and more than 750,000 face shields. Meanwhile, the Foreign Secretary and my fellow ministers at the FCO are on calls with counterparts around the world every day, working to secure new deliveries from abroad with the support of our excellent and tireless diplomatic service. Now, from the start of this crisis, the UK has played a leading role in tackling the spread of the disease and the world's response to it. We are uniquely placed to do so as a member of the G7, the G20, NATO, the Commonwealth, United Nations, and as a major donor to the global health system. And as the Foreign Secretary laid out in his previous statement, our international strategy is focused in 4 key areas: securing a strong and coordinated global health response, particularly for the most vulnerable countries, accelerating the search for a vaccine, more effective treatments and testing, supporting the global economy, keeping trade open and securing critical supply chains, keeping transit routes, hubs and transport routes open to support the flow of freight and medical supplies, and, crucially, to bring our people home. I've outlined our support for bringing British nationals home, Mr. Speaker, but would like to touch on our good progress in other areas. We are helping vulnerable countries with their response to coronavirus by announcing up to £744 million in aid, including for R&D and support to the World Health Organization, UN agencies, NGOs, and the Red Cross. And today, my right honourable friend, the International Development Secretary, also announced a funding pledge equivalent to £330 million a year over the next 5 years to Gavi, the Vaccine Alliance. This will fund the immunisation of 75 million children against other deadly diseases, supporting the world's poorest countries so they can cope with rising coronavirus cases. On the COVID-19 vaccine, this government has already committed £360 million as part of our domestic and international effort. This investment includes £250 million to the Coalition for Epidemic Preparedness to support coordinated global research. This is the single largest contribution by any country. And we are helping to keep vital trade routes and supply chains open by coordinating closely with allies and partners in the commercial sector. And finally, Mr. Speaker, the UK has a responsibility to protect the safety and the security of the people of overseas territories, most of whom are British nationals. So we've been providing tailored support to our overseas territories, ensuring that the appropriate resources are provided to them during the coronavirus response. Mr. Speaker, the scale and impact of this pandemic has been unimaginable, but working alongside our international partners, the UK has been able to demonstrate the kind of leadership, cooperation and collaboration that will get us through this crisis. And I commend this statement to the House.
We now go over to virtually Lisa Nandy over in Wigan and welcome her to a new position as Shadow Foreign Secretary. Lisa Nandy.
Thanks very much, Mr. Speaker. I can confirm that it is as sunny as always in our neck of the woods. Can I start by thanking the Minister for advance sight of his statement and for the weekly briefings that have allowed us to work together over recent weeks to bring some very vulnerable people home. And in that spirit, can I turn to a number of issues that his statement did not address so that we can begin to resolve those too? I am deeply concerned that weeks after Britons were advised to return home by the government, there's still no accurate assessment of who is stranded and where. On Monday, the Foreign Office came up with a figure of 57,500, and yet I've been told repeatedly that there can be no accurate assessment because while some embassies record those who approach them for help, others do not. We do need to know who is stranded and where, so will he now ensure that his department counts and publishes those statistics so we can rapidly bring those numbers down? I was very glad to hear that the numbers returned on charter flights are up to 19,000 on 93 flights, and I again place on record my thanks to our diplomats, embassies and consular staff. But this is still frustratingly slow by comparison with other countries like Germany, who by early April had repatriated 60,000 citizens on 240 charter flights. By chartering 20 times the number of flights, they were able to bring their citizens home weeks ago. And I would like to place on record my thanks to Germany and to other countries who've offered spare places to stranded Britons on these flights, but I'm sure he understands why people are upset and frustrated that their government hasn't done the same. Now, I know that the government was keen to reduce costs, but this reliance on commercial flights has left far too many British people at the mercy of cancelled flights, airline strikes, extortionate prices, domestic lockdowns and chaotic booking systems. So can he today commit to rapidly scaling up the number of charter flights? It's not clear to me what the barrier still is. 90% of the country's commercial fleet is currently grounded. The RAF stands ready to help. Other countries have the same problems that we do. And in recent weeks, I've spoken to many global leaders who say that there is a willingness to work together internationally to open airspace and keep those transit hubs operating. Now, I know that he is doing his best, but this is quite unlike the problems the government has had with testing or PPE. We have the capacity to do more and we must. There are many people on those charter flights who've told me that they're being charged up to £1,000 a ticket. So it'd be helpful to understand where that £75 million the Foreign Secretary announced has gone. Has it been spent? And if so, what on? on. And after the Foreign Office website this week suggested that Britons in New Zealand might be better off staying put until the crisis is over, can he commit that all British people who need it will be not just helped, as he suggested, but repatriated, and the cost will be no barrier to bringing our citizens home? I also suggested to him last week that it be made easier to apply for emergency loans and that people be allowed to claim universal credit from overseas. He gave me a very enthusiastic response. Can he update the House on progress with this? Can he also tell us what support is being provided to non-UK nationals, many of whom have lived and worked in Britain for decades? Many that I'm in touch with are extremely vulnerable. Others are NHS workers who are desperate to get back to the front line, but some of them have been told that they are at the back of the queue, while others have been told to contact other countries' embassies for help. Now, we were recently shamed by the treatment of those who made Britain their home and have lived and worked here for decades, and we mustn't allow this to happen again. So I hope he'll take this opportunity to reaffirm our commitment to those non-UK nationals and guarantee them the same rights to return home. Finally, I'd like to ask him about the mixed messages that those returning home are getting. At the weekend, a government source told The Telegraph that a 14-week quarantine period would be introduced. When the Foreign Secretary was asked, he simply said, "I don't know." Yesterday, the Transport Secretary wrote to MPs to tell us that targeted screening measures had been carried out at UK airports, but that these have now been stopped. This is really worrying. There are people entering the UK from countries where infection rates are rising, access to healthcare is limited, and preventative measures are non-existent. They are travelling back to their families on public transport. This is surely not sensible. We've discussed this several times. It is frustratingly one of the areas where we've been unable to make progress. And the UK is now a major outlier on this. South Korea, the Netherlands, Greece, Lithuania, Singapore all have self-isolation requirements in place. We must have clear advice for those returning to the UK, a quarantine period and testing on return to limit the spread of the virus. Can he commit to this today? And if he can't, will he take this away and ensure it's acted upon? As always, I am ready and happy and willing to offer assistance and support where I can.
Minister.
Thank you very much, Mr. Speaker. And through you, can I congratulate the Honourable Lady on her appointment and also for the spirit in which she has cooperated. We do speak regularly with our weekly phone calls. I think we're due to have one tomorrow where myself and officials are able to update her. And I've been nothing but impressed with the Honourable Lady's constructive approach to this very difficult matter. But could I just try and answer some of the points that she's raised? I'm sure she'll remind me tomorrow when we have our phone call if I didn't get around to answering all of them. She talked about the data and posts having that information on the number of people who want to return home. Our best estimate at the moment is around 50,000 people, and hopefully by the end of today we will have passed the return of 20,000 British nationals on the charter flights. We will obviously update the Honourable Lady with the numbers tomorrow. It is tricky collecting all the data. I won't pretend that it's not, but I can assure her when we do have that information, we will keep the Honourable Lady updated. I just would like to politely, in the kind of best spirit possible, politely remind the Honourable Lady when she was referring to the number of people that have been repatriated by other countries. Of course, other people have taken slightly different route on getting people home, but can I just remind the Honourable Lady and the House that over 1.3 million people have come back to the UK since the start of the outbreak. That's a phenomenal number of people. We have worked with the commercial sector to ensure that routes are open, ensure that flights are available. And clearly now we are focusing on those countries where there are large numbers of British nationals and where there aren't commercial flight options. So I would hope that she would recognise that our strategy of working with the commercial sector initially has paid dividends. We're now focusing on our charter efforts. We are indeed prioritising British nationals. on these repatriation flights. That's our first priority, those that are vulnerable and those that faced the greatest risk. This might be because a country doesn't have a health service that's comparable to the NHS, but we always do our best to consider making space available for others where there are, not least those who are, as the Honourable Lady mentions, key workers, in particular NHS, where we can, where possible. She also mentioned about the advice that those returning to the country have been getting. It's absolutely the case that people booking onto these flights, anybody who is symptomatic, cannot take a charter repatriation flight organised by the UK government back to the UK. That's absolutely clear. They won't be allowed on the plane. They're given advice on the plane in terms of what they should do. Anybody arriving in the UK on a flight or from another country should follow the current Public Health England advice, specifically regarding social distancing and self-isolation. We've continually tested strategies with scientists, such as quarantining those coming from abroad, to make sure we're able to take any measures which are necessary. And I would point out to the Honourable Lady that as we consider transition to the next phase, the second phase, we will be looking at these issues. We've already had discussions with other departments across government to make sure we're taking all necessary measures to preserve our way of life and to protect people.
We now go over to the Chair of the Select Committee, Tom Tugendhat. Tom Tugendhat.
Thank you, Mr. Speaker, and thank you very much for calling me to speak today. Can I just say congratulations, of course, to the Prime Minister, and Ramadan Kareem to so many in our community who are celebrating the holy month at the moment. May I ask the Minister what improvements he's going to make to the communication system that he's been using to communicate with British people around the world? In the Foreign Affairs Committee, we've been holding a survey which is online on the Parliament website at the moment, to ask people what their experience is, both good and bad, of being repatriated to the UK. And the main issue that we found is the inability or the difficulty with which some people have been communicated with when they're abroad. There are good examples, like the High Commission in Kenya, and there are difficult examples, like the High Commission in India. And seeing how we improve that would be important for the whole community.
Thank you, Mr. Speaker. The Chair of the Select Committee raises an incredibly important point, because the most important thing, if you're a UK national, you're stuck abroad, you're concerned, your flight's been cancelled by your operator, you want to have some assurance that the government is on your side and is going to assist you, and communication is absolutely crucial. I totally accept at the start of this crisis that our comms in some parts of the network wasn't as good as it should be. There are some brilliant examples which the Honourable Gentleman refers to. I'd also point out to our post and the great work that our High Commission in New Zealand has been doing in terms of communicating. We have put an awful lot more effort into ensuring that our embassies and our consulates up their communication game. It's so important, because if you're, as I say, if you're stuck, you want to make sure that at least you are being, even if there's no news, you are getting some information. So I totally accept the Honourable Gentleman's point.
We now go across to the SNP spokesperson. We now go across to Alan Smith, who has 2 minutes. Alan Smith.
Thank you, Mr. Speaker. It's good to see you virtually. I thank the Minister for sight of his statement in advance, and on a consensual point, I'd very warmly welcome the announcement of funding for the Vaccines Network, the Gavi programme, which the SNP called for some time back, and glad to see we're in agreement. That's really going to do a lot of good in the world. On repatriation, without getting into the specifics of it, I have to echo a number of the concerns raised already in this discussion. I myself have praised the work of FCO officials who are working really hard under tough circumstances. But I have to say this statement seems rather more Panglossian than the experience of a number of my constituents, and I'm quite sure of constituents across the House. Can the Minister commit to an inquiry into the FCO handling of this issue in due course, so that we can learn lessons for the future, not least focusing on the issue of the defunding of the FCO network, which has left it really at a loss that it didn't have the capacity to cope with this. But can also touch on the procurement aspects of this statement, and I'm struck that it didn't make a single mention of the EU procurement issue. There was a quite remarkable session of the Foreign Affairs Select Committee recently where Sir Simon MacDonald had to clarify his clarification. And reading from the letter, he said quite explicitly, ministers were not briefed by UK mission on the EU's joint procurement agreement. He then goes on to say, owing to an initial communication problem, the UK did not receive an invitation in time to join the COVID EU procurement response. Now, forgive me, it seems quite inconceivable to me that UK mission did not make London, call it that, aware of the existence of these schemes. So can the Minister perhaps clarify, were officials in London briefed by UK mission on the existence of these schemes? And can he assure us that where there was an initial communication problem, I quote, was it between UK mission and London, or was it within London? In that we missed out on these procurement schemes. They could have been of value to our constituents. And can he assure us that these problems have been dealt with and we will contribute to and participate in future EU procurement schemes?
Minister. Thank you, Mr. Speaker. Can I thank the honourable gentleman again for the way in which he has been very constructive in his dialogue with government, and also his SNP colleagues in Scottish Government. I have weekly update conversations with all the devolved administrations, and indeed they are just as constructive. And also, I would just reiterate the point from one of his early points, that the combination of working with the scheduled flights and the commercial sector has enabled over 1.3 million people to get home. So I think there is something to champion. Of course, the network has been put under extreme pressure. We've never faced anything like that. We've never had to repatriate effectively people from all over the globe before. But I think that we've done a pretty good job in our repatriation so far, especially as we will pass the 20,000 charter flight mark today. With regard to his latter point, the Permanent Secretary of the FCO has issued a correction to the FAC. He's setting out that position, make clear that a political decision was not taken on whether or not to participate. And as the Health Secretary has said, we will participate in the joint EU procurement scheme on therapeutics that is soon to launch. And we've been clear that we will consider participating in other future schemes on the basis of public health requirements, including on any PPE. And finally, I just remind the honourable gentleman, there are currently around 10,700 mechanical ventilators available to the NHS across the UK, with thousands more in the pipeline.
We now go across to Richard Drax. Richard Drax. In which case, I will go across to Alistair Carmichael. Alistair Carmichael.
Thank you, Mr. Speaker. Can I take the Minister back to the two positions taken last week by Sir Simon MacDonald? These are not differences of nuance here. They are two fundamentally different positions. Can the Minister maybe share with the House the explanation that Sir Simon gave him for two such different positions being put out in the course of one day? And more importantly, even than that, though, can he give us some assurance that if EU procurement processes are to offer a route to our much-needed PPE being available in care homes and hospitals across the country, that we will not lose out on that opportunity?
Thank you, Mr. Speaker. Well, at risk of repeating myself on this point, Mr. Speaker, it's actually the case, the Permanent Sec, he issued his correction to the Foreign Affairs Committee. He made it very clear that a political decision wasn't taken on whether we should participate in this scheme or not. And again, I'll just reiterate the answer I gave to the SNP. The Health Secretary has confirmed we will participate in the joint procurement scheme on therapeutics. That is soon to launch, and we made it very clear that we will consider our participation in other future schemes on the basis of public health requirements, and this includes PPE.
William Bragg. Thank you very much, Mr. Speaker. And following on from my right honourable friend, could he further elaborate the work that the Foreign and Commonwealth Office has done to source PPE supplies for our frontline health and social care workers? Are pre-existing supply lines working? Because this will be crucial in the government assessing its key pillar to have adequate supply of PPE for any decisions on loosening the lockdown.
Minister.
The honourable gentleman makes a very good point. As I said in the statement, the Foreign Office is in addition to the domestic work that we are doing on PPE. We have helped secure, I've had conversations with our posts in China, and from China alone we've had we've had over 1/3 of 1 billion pieces of equipment. That work is continuous. All our posts are on the hunt for equipment. That is one of their tasks, and they're doing a pretty fine job.
We now go over to Clive Lewis in Norwich. Clive Lewis.
Thank you, Mr. Speaker. Like a number of members, I still have a number of constituents trapped in different parts of the world. One couple from Norwich have been trapped in New Zealand for well over a month now. They're running out of money. They've been refused a refund from their travel company, face exorbitant flight prices that they can't afford, and are becoming increasingly desperate. So can I ask the Minister what pressure the Foreign Office is putting on travel companies to refund British nationals trapped abroad, and to reiterate the point made by my colleague, the Honourable Member for Wigan, why it's taken so long for sufficient charter flights to be put on compared to countries like Germany, who've managed to already get most of their trapped nationals home?
Minister.
Well, I thank the honourable gentleman for his point. On New Zealand, I'm pleased to say that over 600 UK nationals have returned. Most of the commercial flights, and one of the problems is most of the commercial flights back to the UK have been suspended, so flight availability is extremely difficult. We are now chartering flights to help bring back the most vulnerable British nationals stranded in New Zealand. There's 5 initial government charter flights started on the 24th of April. They'll bring home over 1,500 people. And just on costs, I do accept his point, the way some airlines have dealt with their customers and not giving cash refunds. I don't agree with that. I think it's incredibly bad form of the airlines not to provide timely refunds to their customers. The cost of the repatriation flights are at a reasonable level, maximum of £800 if a flight's over 10 hours.
We go over to Ray Manchester. Ray Manchester.
Thank you, Mr. Speaker. Through the Minister, can I thank all the fantastic work done by the FCO team in bringing back my constituents from Fiji, from New Zealand, from India, from Pakistan. And I know there's 10 chartered flights that have taken place from South Africa. However, I have a 80-year-old constituent just outside Johannesburg who's supposed to be coming back to Rainham on the 4th of April. She's been told by her tour operator she's unlikely to come back before July. Can I ask the Minister to urgently look at this case? I have already raised it with the Minister for Africa, who's been exceptionally helpful, but can I please urge him to do everything that can be done to help this 80-year-old constituent of mine?
Minister.
Of course, the FCO will look into the case the honourable gentleman raises. I would like to thank him for the praise for the work that's been done returning his constituents from around the globe. As he will know, we've got over 2,000 British travellers back from South Africa on our special charter flights, but we will certainly look into that individual and see what support we can give through our network.
Dr. Rupert Huck.
Mr. Speaker, the Minister talks a good talk, and it was good news for my constituent when he was able to get over to see his ailing elderly dad for probably the last time, for the first time in 8 weeks. But the bad news is it was in blockaded Gaza, where there's no flights in or out of what David Cameron called a open-air prison, an open-air prison. So look, will the Minister, who I have raised this with on a conference call on the 15th of April, please have a word with his officials, who up to date have told my constituent that it's his own fault, and get a family of 4 British citizens in Acton their dad back for Ramadan?
Minister.
Thank you, Mr. Speaker. I will say, of course, we will take up that case if it's not already been taken up. I doubt very much whether a member of the FCO staff would use language like "it's your own fault," frankly. But we'll certainly follow this up. We are due another conference call later on this week, on Friday, which I'm holding for honourable and right honourable members. But we will certainly follow that case through for it.
Gagan Mahindra.
Thank you, Mr. Speaker. Can I firstly pass on my thanks for the work his department has done during this unprecedented pandemic? Would my honourable friend update the House on progress made by his department in offering consular support to British nationals, especially in Peru?
Minister.
Of course, the honourable gentleman raises a very important area, Peru. It's been a very difficult country to deal with, given the amount of backpackers and travellers that are dispersed over a very large area. We've got 1,100 people returned on 5 flights. People that are back. There are no commercial flights running. We still do have our consular staff available, and other staff in the embassy continue to provide assistance in that region to British nationals.
We go over to Lucy Powell in Manchester. Lucy Powell.
It's very sunny here as well, Deputy Speaker. The travel industry is facing an unprecedented crisis, and whilst completely understandable given the current circumstances, the Foreign Office's indefinite travel ban means it's very hard for companies to plan for the future. What thought is the Minister giving to how that advice might be eased when it's safe to do so? And has he been involved in the discussions taking place today with EU partners about the forthcoming summer holidays and how they might be made to work?
Minister.
Well, I can tell her on a final point, the Honourable Lady, I haven't as yet. I've been at the Foreign Office and here at the Commons. We are constantly talking as the FCO to the travel sector. Of course, many elements of the travel industry have been decimated by this unprecedented event. It's absolutely crucial, though, that we focus on the job in hand, and the FCO's main focus at the moment is to get British nationals home. But she makes a very fair point. There will have been discussions with the travel sector as we approach the summer holidays, and I'll be delighted to update the Honourable Lady in a further call.
We go over to Dr. Andrew Morrison. Dr. Andrew Morrison.
Thank you, Mr. Speaker. Can I very much welcome the Minister's comments about Gavi, the Vaccines Alliance. The government's leadership in this matter is extremely timely. Will the Minister say what part the FCO played in Exercise Cygnus in 2016 and what exercises the Foreign Office has subsequently run to test the UK's ability to repatriate British nationals in the event of a crisis of the sort we're living through now?
Minister.
I thank the right honourable gentleman for his question. Now, clearly, with reference to the Cygnus exercise, I'm not aware of how involved the FCO was back in 2016, but the government regularly, as his constituents and the country would expect, regularly tests pandemic plans. Cygnus was, I understand, a test of domestic preparedness for a future flu pandemic. And of course, the lessons learnt from Cygnus continue to be considered by government when we are reviewing our responses.
We go over to Pat McFadden. Pat McFadden.
Thank you, Mr. Speaker. I have a number of constituents who are still stranded in Punjab in India, some of them in real distress. Now, I recognise the effort from the Foreign Office in chartering flights from Amritsar, but after several weeks of this effort, my office is still receiving large numbers of calls from people with serious medical needs who've so far not been allocated a place on any of the charter flights, and importantly, don't know when they will be. So can I ask the Minister, when does he think this repatriation effort will be completed?
Minister.
The honourable gentleman raises a very good point. India, as you can imagine, there were tens of thousands of British nationals in India. We've got back over 10,000 on 38 flights so far, and we've got another 14 planned. Of course, with India, we are prioritising, doing our best to prioritise the most vulnerable who have registered that they want to come home. We expect that we're able to get the number to 13,000 coming back from India. We are repatriating people from multiple cities across India, and we will consider the option of additional flights after these particular flights based on need and circumstance. But the honourable gentleman flags a very important area for us.
We go over to Theresa Villiers. Theresa Villiers.
Thank you, Mr. Speaker. Can I ask for the government's help getting people back from Pakistan, because I have constituents there? And can I also ask him to provide more reassurance to constituents here who are worried about the continuation of flights from COVID hotspots like Iran without sufficient work going into checks to making sure that incoming flights from different parts of the world aren't potentially making our virus situation worse?
Thank you, Mr. Speaker. The Right Honourable Lady raises Pakistan, another area where there are thousands of Brits wanting to return home. We've got over 2,000 people back already. We've got another 9 flights planned. So I can assure the Right Honourable Lady that through our mission in Pakistan, we are doing our utmost to get people back. We're also putting on flights from Karachi as well, because obviously the size of that particular country. With regard to the health point that she raises, I mentioned it earlier. The Public Health England is the current advice we are giving people as we enter phase 2 of these repatriation flights and phase 2 of the pandemic here. We are going to be looking very closely at the advice that we're going to be giving. But no one who has got symptoms of this virus can get on one of these flights.
Chris Elmore.
Thank you, Mr. Speaker. Can I take the Minister back to the whole issue of EU procurement schemes? It seems at the moment that at the very best the situation is confused and at very worst rather fishy, and the Minister's answers aren't giving any more reassurance or clarity. So can I ask him, was any Minister briefed about any of the schemes? And if not, why not?
Minister?
Well, again, Mr. Speaker, at the high risk of repeating myself on this point, and I particularly understand why the opposition might want to probe this politically, but the Permanent Secretary issued his correction to the committee. He set out his position very clearly, and that was that a political decision was not taken, and repeat, not taken whether or not to participate. We will be joining the scheme on the EU procurement scheme on therapeutics, and any other scheme will be considered by the government according to the public health requirements of the UK.
Anthony Magnet.
Thank you, Mr. Speaker. Can I thank the Minister and his Foreign Office team for all the help that they have given me and my team in returning constituents of mine from across Totnes and South Devon to their rightful place at home. But there are some lessons to be learned from this situation, and I ask that the Minister might consider that the Foreign Office performs a retrospective analysis of how we have repatriated British citizens and presents that report to this House so that we may be able to scrutinise it in future. Because I think those shortcomings will need to be addressed. Added to which, should we not also be looking at the cooperation that could be had between public and private sector when it comes to commercial flights?
Minister.
Well, the honourable gentleman makes a very sensible point. Of course, we learn from every day. We learn from the lessons of such a huge operation. This is something we've never faced before. The nearest we've come to it is the Thomas Cook repatriation not too long ago. This is a point that a previous questioner asked that I didn't get around to answering. So we learned lessons from that, but this is on a scale that's unimaginable. You know, never before have we had to repatriate this many people. Over 1.3 million people have got home via commercial routes. We have been working very closely with the commercial sector. The airline industry, a number of airlines have signed up an MOU with government so we can ask them to bid for charter flights. But it raises a very good point, and no doubt this will be something that we do look at in the cold light of day.
Mark Weston.
Thank you, Mr. Speaker. And can I add my comments of congratulations to the Prime Minister and Carrie Symonds on the birth of the child. On the 24th of March here in the Chamber, I asked the Foreign Secretary about the situation of my constituents stuck in India and elsewhere around the world. 40 are still stuck in India, including Lashkar Singh Jyoti and Surinder Jyoti, who've been resident in the UK for almost 50 years. She is a specialist neuro care worker who needs to get back to work. There seem to be echoes here of the Windrush scandal, in that they've been told they are not eligible for consular support. She's needed back at work, as I say. Can I ask the Minister to intervene and help them and all other UK residents be returned and repatriated to the UK?
Minister.
Can I just answer the honourable gentleman by referring to a previous answer? We are prioritising British nationals. These flights are paid for by the British taxpayer, so our initial priority is with British nationals. Of course, those that have indefinite leave to remain, they should not be discriminated against in any way. The priority initially was British nationals. We're certainly not in the business of breaking up family groups. We want to ensure that families are kept together. I would very much appreciate if he could flag with my office that particular case, and we see if we can drill down and get those people home.
We go across to Surrey, Lancashire. Anthony Higginbotham.
Thank you very much, Mr. Speaker. And can I first thank the Minister and the entire FCO team for everything they are doing. I know they're working around the clock, not just to return my constituents to their home, but all of our constituents. If I might come back to the topic of Pakistan, I'm very fortunate that many of my constituents are now home from Pakistan, but there are still some left there. Could the Minister give some reassurance that the repatriation flights being run by the government will continue until such a time that commercial flights resume? I know that was the situation before, that PIA were running commercial flights, but until they do actually commence, and we're not talking a promise to commence them, will our repatriation flights still go?
Minister.
Thank you, Mr. Speaker. And the honourable gentleman, I know, has been incredibly resilient and has pursued FCO ministers on the individual cases of his constituents, and he's absolutely right to do that. We are launching a new phase of flights back from Pakistan. We've had 2,000 back on our special charters. It's worth pointing out the point about Pakistan International Airlines. We are working very closely with the government of Pakistan and PIA to ensure the continuation alongside these charter flights. And it's worth also mentioning, Mr. Speaker, that since the 4th of April, over 13,500 people have returned to the UK on 40 commercial PIA flights through that negotiation alongside our charter flights, which is